Good evening. I'm Joe Cleveland, a adult cardiac surgeon at the University of Colorado, and currently the chair of the Council on Health Policy and Relationships with the Society of Thoracic Surgeons. It's my pleasure to welcome you tonight to STS webinar at an inside look at STS advocacy and understanding how collectively we can all make an impact. We have a distinguished panel, which I'm now going to call on each to introduce themselves. Dr. Vinay Badhwar, would you please introduce yourself?
Thanks very much, Joe. I'm trying to get my camera on. Maybe our team can put it on, but my name is Vinay Badhwar. I'm a cardiac surgeon based out of West Virginia University in Morgantown, and
You're on.
I serve the STS as the chair of the Council on Quality Research and Patient Safety that governs most of the quality enterprises as well as the STS database.
Thank you. Dr. Frank Nichols.
Yes, thank you, Joe. I'm Dr. Frank Nichols. I'm a general thoracic surgeon at the Mayo Clinic in Rochester, Minnesota, and I'm the chair of the Society of Thoracic Surgeons Workforce on Coding and Reimbursement.
Dr. Karen Kim. Still, we can't hear you, Dr. Kim.
Okay, how about that?
There you go. Oh, no.
I'm Karen Kim. I'm an adult cardiac surgeon at the University of Michigan. I'm an enthusiastic contributor to the STS-PAC and also on the board of advisors for the PAC.
And Dr. Raymond Strobel.
Thank you. Yes, my name is Ray Strobel. I'm a PGY4 integrated cardiothoracic surgical resident at the University of Virginia, interested in adult cardiac surgery and in the intersection of health policy and outcomes, and I serve as a member of the workforce on healthcare policy advocacy and reform.
So as we start our remarks this evening, we have a very small set of slides we'd like to share with you, but I want to remind everybody in the webinar, obviously this is meant to be interactive and we really welcome your input. So please feel free during either the slides to send questions via the chat, and we'll leave ample time at the end. Dr. Badhwar will start our formal remarks. Dr. Badhwar.
Thanks very much, Joe. Yeah, one of the really important things of advocacy that STS has led for our specialty is that it doesn't matter what domain you're in, what specialty of interest you have, or what level you are, whether you're an early careerist, veteran, CT surgeon. The common tie that binds us is advocacy, and particularly for those early careerists, I would just send a message before we dive into the quality aspects, is that this is a great way to get involved. You see Ray Strobel here, who is a young surgeon I've been working with also recently. It's great to see Ray on this call, but also any of the early careers that want to get involved in STS. Advocacy is a wonderful way to do that. And I think that will come out through Dr. Cleveland's comments and many of the other colleagues here tonight. One area that I'm particularly interested in is how advocacy impacts quality. Really one of these areas that has helped shape us, and I think the leadership of our STS staff, largely under Courtney Yo, who's really been a force to be reckoned with on the Hill, along with Dr. Cleveland and many of the Dr. Nichols and Lahey, all of the people that you see on the call tonight, have really helped spearhead a lot of these issues for us. And we owe a debt of gratitude to all of them. One area of my interest is in access to Medicare claims data. And this has huge value to improve not only our academic footprint and how we can take cost and longitudinal claims information and incorporate it into quality outcomes, but also the hints it leaves to new payment models, as well as other types of registries. Largely you see written on your slide there, the TVT registry, but it can be many other avenues as well. HR 5394 is a bill that STS had backed and helped shape. And through advocacy and the partnership with many of our providers on the Hill, congressmen and others that backed this bill, as you see on your slide there, it really helps access to Medicare claims data for the purposes of research quality, care reimbursement, and reporting, including potentially public reports, but also medical research and looking at how we incorporate that into reimbursement long-term. Importantly and excitingly, these efforts that started at sort of a grassroots level, working with our congressional representatives and STS's advocacy, has helped include HR 5394 into the 21st Century Cures 2.0 legislation, which many of you, if you're aware, is really the foremost juggernaut for us to improve healthcare in the United States. So I'll conclude my comments there, Dr. Cleveland, and turn it back over to you to moderate. But I'd like to take the opportunity to just do a shout out to Dr. Frank Nichols. Dr. Nichols has been an advocate of advocacy and reimbursement and coding for many years. And often he and his leadership team really need our thanks, because it's through his efforts and the whole team and the coding and reimbursement workforce that really has helped us take it as maximum advantage as we can for coding. So I'll turn this over to Frank Nichols to talk about reimbursement. Frank?
Thank you. Thank you so much, Vinay, and thank you for the kind words. As you sort of alluded to, advocacy is a lot more than just about reimbursement, but at the end of the day, reimbursement is important, okay, to all of us. Just about 3 weeks ago, the CMS proposed rule for 2023 reimbursement came out, 2,066 pages, okay, worth of government speak that Courtney and her team are going to work their way through, and STS, along with many other societies, are going to comment on. A little bit about reimbursement. STS advocacy has helped to avert or mitigate dramatic cuts to Medicare over the years. Just in 2021, 2020, 2022, we saved about $9.5 million in restored reimbursement for cabbage and about $750,000, okay, in restored reimbursement for lobectomy. The problems haven't gone away. In this year's proposed rule, there's a 4.5% decrease taking place in terms of the conversion factor that will affect us. There's also other fixed cuts because sort of Medicare spends more than it's supposed to that are going to hit us. Okay, sequestration, okay, something that went away a bit with the pandemic is back again, and that's worth about a 2% cut. And then there's also a thing called pay as you go, which is another 4% cut. So we will have comments on all these things and have to go to the Hill, okay, to talk with our congressman yet again, okay, asking them to avert these cuts. We won't be alone though, okay? The AMA takes a strong stance on this, as does the American College of Surgeons and the Surgical Coalition. This was an interesting slide that just came to me this past week from the AMA talking about inflation. Just think about it, not a minute goes by throughout the day you're not hearing about inflation. You're seeing it in your pocketbooks too, in terms of maybe your office expense, your gasoline expense, etc. But here's a slide that shows, okay, how physician payment has not kept up with inflation over the last 20 years. You can see how there have been increases in payment for skilled nursing facilities, outpatient hospital, and inpatient hospital. Those are the top 3 lines. You can see the consumer prices, how they've changed. But then for physician practice, physician reimbursement has just not changed at all in about a 20-year period of time, and this is a problem for us. But with that, this is really about advocacy today, and not just reimbursement. But rest assured that our society will be commenting to CMS again, along with others, on reimbursement for 2023. Joe.
Thank you, Frank. And I neglected in our introduction to, you may have seen a picture of Steve Lahey. And unfortunately, Dr. Lahey couldn't be with us tonight, so I will deliver his part of the presentation tonight. Steve is our chair of our workforce on advocacy and health policy reform. And so as that, a lot of questions, how do we kind of design, or what do we say is our roadmap each year for advocacy priorities and policy papers? And so How are advocacy priorities selected? Well, each year the workforce on health policy reform and advocacy sits down with a list of issues that, combined with the STS staff, Courtney, others, that we've heard primarily from the membership, because again, remember, we're a very much a membership driven organization. We want to really be the voice of our members. We'll provide insights, information on these different things. And the criteria really are not, super hard, but it kind of is in three general buckets. One is we try to make it relevant to, again, STS members. We want to pursue things that are that are creeping up in practices, et cetera, that get our attention from the membership as this is a priority. Secondly, we want to be, somewhat successful in the sense that we have to understand the political environment in Washington. And as much as we would love to believe that's obviously something that's doable, Courtney and her staff, again, are extremely professional and really can tell us, hey, here are the way the winds are blowing in Washington right now. And take, for example, medical liability reform, something that we would all like to see, but you got a Democratic Congress, a Democratic president, that's probably not going to play real well right now. So that's a priority, but we're going to kind of keep that in the back burner and perhaps push some things that we might have some chance of success with. So we do look upon that as something that's a criteria. We try to be, again, obviously, as the largest professional organization for cardiothoracic surgeons, we obviously look to our patients. We are, obviously, we want at least one patient advocacy topic because we want to be able to speak for them, obviously. And just because you don't see it as maybe one of our top 4 or 5 priorities does not mean we're working on it. So just understand that you may see, well, why aren't we working on this? Or why aren't we working on this? It is somewhat, there's a lot of different balls we juggle. So what are some of the policy papers and things we do as well? And there's an STS health policy compendium we'll talk about a little bit. Here's a list of our advocacy priorities. And again, you'll see these, but we obviously want to ensure patient access to cardiothoracic surgical care. So as Dr. Nichols just alluded to, that if we can't keep offices open, if practices can't employ their staff or can't meet their expenses because of cuts, then that's going to affect access for our patients. We have a large workforce shortage that when you look at the AAMC report, when you look at things that have been generated within our own specialty, we're going to be between 3,000 and 5,000 surgeons short in the next 20 years. And again, as we all know, you just can't dial on and train a cardiothoracic surgeon in a year or two. It's an 8 to 10 year process. And so this is something that's very important to us. We want to ensure that long-term payment models meet the need of cardiothoracic surgery. So while Frank mentioned we'll go to the Hill this year, we'll talk about that in a little bit, and Dr. Strobel will talk about that. But how about long-term solutions instead of just these stopgap measures we're doing? Health equity in healthcare is a large priority for us. We really believe that there should be health equity for all patients. Vinay mentioned a little bit coverage with evidence development policy, Medicare claims data. These are vitally important for us to be able to again, utilize our own database to show, again, that we are keeping track of our outcomes. We want to provide value for the health system in general, and we can do that with these things. And lastly, we want to preserve healthcare research funding. Next slide, please. So we have a large list of published health policy compendium. You can go to the STS website, and these are on the right. I won't lead the laundry list of topics, but they're important things. Comparative effectiveness research that compares things like CABG to PCI that have been done. And if we write these policies, so these policies consist of an overview of the issue, the background, and what we're going to do about it. So you see things in here: graduate medical education, again, medical liability reform, lung cancer screening, tobacco and nicotine, health equity. So there's a lot of these policies that actually have written statements that comprise the STS Health Policy Compendium. So with that, I will turn things over to my esteemed colleague, Dr. Kim, who's going to tell you what is our collective voice that we can use with the Political Action Committee. Dr. Kim.
Thanks, Dr. Cleveland. So you see some questions here. I will just go down them one by one. What is the STS-PAC? Well, PAC stands for Political Action Committee and was formed in 1997 as a tool to be able to accept voluntary donations from eligible STS members, so we could support members of Congress or candidates running for congressional election who can help us achieve our advocacy priorities, such as the ones you heard mentioned by Dr. Cleveland. When you contribute, where does your money go? Well, that's where it goes, to the people in Congress who can help our patients and our specialty. And how do we decide who to support? We set priorities for allocating the contributions based on different factors that can include but are not limited to, for example, chair and ranking members of key committees and subcommittees with jurisdiction over healthcare issues, party leadership in the House and Senate, cardiothoracic surgeons and other physicians who are congresspersons, members of Congress who have supported key STS advocacy priorities or who have sponsored or co-sponsored bills endorsed by the STS, members of Congress who communicate with federal agencies in a way that's beneficial to cardiothoracic surgery, and members of Congress or candidates who have relationships with STS members or those who are recommended by STS key contacts or contributors. So those are just some of the ways that we allocate or decide how to disperse the contributions that we get. How is STS-PAC different from advocacy or STS advocacy? I kind of feel like advocacy is a broader term that to me means participating in the process of helping our patients, our colleagues, and our specialty. And if you think about it, we all actually do that every day. So everyone who's listening to this webinar, you're all advocates, even if you may not have realized it. But the PAC is just a tool, one way, an important way of participating in this advocacy process. And on this webinar, you'll learn other important ways to contribute as well. This is a look at our disbursements for 2021. You can see that overall it was nonpartisan for both the House and the Senate, and that's the approach that the STS-PAC takes. Some of the different members of both parties or other parties may support our important advocacy priorities, and so every year you'll see that it's about 50-50. So in addition to being part of the STS advocacy efforts, what do your contributions get you? Well, you have additional benefits, and you can see this in the table to the left. We recognize different levels of giving that range from the importance of giving just $1 to the maximum allowed annually of $5,000. You can see that you get invited to our STS-PAC reception, invitation to exclusive STS-PAC speaker events with Congress members and insiders, an STS-PAC pin, and then very interesting leadership books, different kinds of newsletters, a conference call with political insiders. So, a lot of other ways to gain information about important advocacy issues and priorities as you participate in this process. And now I'll hand off to Dr. Strobel to give us the resident's perspective of participating in advocacy. Thank you.
Well, thank you very much, Dr. Kim. And it's an honor to be here again. As the slide says, my role here really is to talk about what are the benefits of getting involved in advocacy earlier in your career. And truly, it's never too early, and it's certainly never too late to get involved in advocating on behalf of our specialty. And what are the benefits to starting as a resident, or even we've had some medical students get involved. First and foremost, as we've heard from my fellow panelists, advocacy is how we individually help shape the future of our profession for ourselves, for our colleagues and our teams, and most importantly for our patients. Such incredibly important issues such as quality, reimbursement, obviously, ensuring the diversity of our workforce and that we have an adequate workforce to get the job done a decade or two from now, are all critical to the livelihood of cardiothoracic surgery. And so that can't be emphasized enough. Another benefit of getting involved earlier on in your career, although again, certainly this can be built up at any stage, is developing a deep expertise in policy areas that you might have an interest in. For example, Dr. Nichols really deftly broke down the issues surrounding Medicare reimbursement for us. And as I've been learning as a resident, Medicare reimbursement as it interacts with cardiothoracic surgery is an issue that really has its roots in the mid to late 1980s to early 1990s and has kind of snowballed and continued to develop since then. And so as you participate in fly-ins and meetings with your representatives, talking to them on the phone using the Legislative Action Center, you start to develop more of a facility with policy issues, and that can be very informative for conversations with your colleagues, as well as with elected representatives and even patients. Like everything else in our specialty, advocacy is a skill, and you have to practice and get your reps in to develop that skill. And so the best way to do that is to get out there and do it. You know, one of the best ways to do that is to engage in one of our fly-ins. And so we have a fly-in coming up in September 13th and 14th. And so what that is, what you could expect to go if you decide to come, and we hope you do, is that STS members from all over the United States travel to Washington, D.C., and it's typically a day and a half of events. There are some talks, a bit of a 101 on advocacy. If you're newer, you know, a resident or a younger faculty member. And then the bulk of the experience is meeting with your elected representatives, their staff persons. And one of the I think, benefits that I touched upon earlier and that I want to touch upon here as well is the opportunity to connect and network with you know, leaders in our field. It really is tremendous to be here with really international experts on these topics, and to get to learn from you know, these panelists and our leaders in our field. And so during the fly-in, you'll be paired with another person, and that's really a great way to either get to know a new person, maybe reconnect with a colleague that you haven't had the opportunity to see during the pandemic. Now, if the fly-in is just not going to work with your clinical schedule this year, there are also other opportunities. You can work with our advocacy center in Washington, D.C. to actually set up a site visit closer to home, maybe a meeting with your elected representatives when they are in your states. And there are also our PAC events that occur throughout the United States throughout the year that you could also take advantage of. And so with that, just one more plug for the STS Advocacy Conference fly-in. Again, that's in September this year, September 13th and 14th. A great opportunity, whether it's your first foray into advocacy or you're an old expert. It's going to be a wonderful opportunity to advocate on behalf of the specialty and our patients. I'm looking forward to being there, and I hope to meet some new faces there too. And with that, I'll turn it back to Dr. Cleveland.
Thank you, and I'll build on that, Dr. Strobel. While questions are hopefully coming in, I will also share my own experiences, and just the fact that, first of all, you may think, well, gosh, this is, you know, how do I, Joe Cleveland, you know, cardiac surgeon in Colorado, make a difference by going up the hill? Your opinion is extremely important and sought after by members of Congress. So the fact that, you know, you're a cardiothoracic surgeon dealing with, again, some of the most important, you know, diseases that affect their constituents lends you their ear. And I've been uniformly impressed that every meeting I've had in doing this for probably 15, 20 years now, you have the attention of that member of Congress or their staff member. And again, just for some of the, you know, first timers, meeting with a staff person is not a bad thing. If your member is not in the district that day, or back home in the district, or whatever, or is on a vote on the floor, some of the staff people are amazing. And so you will gain insights. And the purpose of this, as Ray mentioned, is to really just begin a process. It's a relationship. And the next time you come back, again, you can bring up, oh, we talked about this last time or something, and people will remember this. And so your voice is extremely important. And so don't underestimate the fact that you may think that, well, why do they care about me? I'm just some doctor coming. It's not that. They really want your input in very important issues. So with that, I'd like to open it up to questions from the participants. So we hope that for those that are listening, please don't be shy. We want to hear your thoughts.
Joe, I'd just like to reemphasize the importance, okay, of our legislators hearing from us. I've heard that time and again. They like to hear from our lobbyists, okay, and things like that, but they really want to hear, okay, from the voter, okay, and they do emphasize, okay, that they'd like to hear firsthand from us about our story and about our patient's story.
Yes, thank you, Frank. I think, again, that's incredibly important.
No questions yet, Dr. Cleveland. But hoping that, and this is Courtney from the STS Washington, D.C. office. Please send your questions in through the Q&A function and we'll go ahead and get to them.
Yeah, so while we're waiting, let me just ask Dr. Strobel. So you can speak to this again as a young careerist. I've never been to Washington, D.C. before. Let's say this is, I've seen this webinar and I want to go now, but what can I expect, and how do I prevent from just saying something stupid or the wrong thing? What would you tell me in kind of a 30-second to 2-minute coaching talk of here's how you conduct yourself when you meet with your member of Congress?
Absolutely. Well, first thing I'd say is to relax. It's going to be fine, and everyone in our specialty has the fundamental skills to advocate on behalf of our specialty. The Advocacy Center in Washington, D.C. is an incredible resource. They know exactly how to take any STS member and kind of give them the 101 boot camp, which is the first part of any fly-in on how to hit all of our asks and do that in a way that's immediately engageable for the congressperson's office. Again, one of the great parts about the fly-in is often you will be paired with another member, often who is more experienced than you if it's your first time. And if it is your first time, the office will often additionally send a member of the advocacy team with you. And so there's a lot of resources, a lot of support. It's one big team down there. And so please don't let it being your first time discourage you. It's a really enjoyable experience, and I think you'll leave wanting to come back.
Thank you.
So Ray, what you're saying, I think, is I remember it the night before, okay, is where we all met, and Courtney and her staff, really go through things, the topics for us. They have handouts, cheat sheets for you, if you will, that we can pass along, okay, then to our representatives or staff. So it's really well organized. I mean, I learned, okay, a lot the night before in that one-on-one session.
I would agree with Frank, and I think the other thing is the pairing is really helpful too. I mean, Dr. Grover kind of walked me through, and for those, I mean, Fred, if he weren't a cardiothoracic surgeon, I'm convinced he would have probably been a congressman, because he is, it's just artful to watch him kind of engage people, the staffers, chat with them, and kind of slide that piece of paper with our ass across, and it's just really fantastic. So again, you'll be paired with some people that are really good, and it's kind of fun, as Frank says. It's good to see people you've done that with before. Let me ask Dr. Nichols, since you just spoke, I want to ask you, so you laid out for us, obviously, about somewhere between 4.5 to 8.5, 9% cuts. So let's play devil's advocate and challenge you a little bit and just say, gosh, I mean, are people really going to feel sorry for us? I mean, we're heart and lung surgeons. I mean, I remember being asked one time when I went to Washington by a representative said, well, gosh, didn't you park your Lexus at the airport and get in here and fly in here in first class and et cetera to come talk to me? And I said, well, no, I actually parked my 2001 Tahoe in the economy parking and rode coach. So tell us again, how do we kind of get our message across that, again, this is tangible and reinforce the fact that this really will affect access?
I think one of the ways, I think that AMA slide is going to be very useful this year. And we've had similar slides in the past of really just how over, a 20-year period of time, okay, look at inflation. I mean, reimbursement for physicians, okay, just has not kept up. And that's a problem. We have expenses. We have expenses for the staff that we employ. And we're a small business. Okay, so we are a small business at the end of the day. So I think that comes across. We're not in it alone either. Okay, there is a surgical coalition and other surgical specialties, okay, that are facing this, and our medical colleagues, okay, also, face this. So we're not in it alone, and we do have the support and cooperation of the AMA, which is a huge lobbying organization, as well as the American College of Surgeons, who we partner closely with, and other specialty societies. It's a challenge though, and part of it is it's year after year after year. I think physicians are the low-hanging fruit, okay, that are there. They're not going to see hospitals close down, but they don't necessarily recognize our individual practice.
Great, thank you.
Joe, can I ask you a question? Is that okay?
Yeah, absolutely.
So, I mean, as the leader of this enterprise, maybe for the audience, position a little bit. We've heard excellent comments from each of these sections about the value of advocacy, but maybe the position of STS and how and why this is such an important enterprise for all members of the STS, whether you're a candidate member or a senior member or an active member, and why for those that are US based, giving to the PAC is very important, but also why it's such a cornerstone in the mission of our specialty.
That's an excellent question, Vinay, and I thank you, because I think, again, all of us, so to take this back to kind of some comments and use some things, as Dr. Strobel said, so all of us have skills, right? We're all leaders. You don't become a cardiothoracic surgeon without having inherent leadership skills. And so I think it's part of our professional responsibility to advocate for our profession and for our patients. And it's quite simple when one boils it down to kind of taking all these different pieces, and then you say, okay, well, what do we do for our patients? Well, obviously, quality and outcomes are job one. How do we leverage our common voice and our common actions to act as a professional society, again, to make that impactful? The database, obviously, things you're involved with. So, again, when you start to just look at all the different things that we do as a member organization, really advocacy is a centerpiece of it, because without us representing ourselves and our patients, you can kind of start to see things kind of spin off in different areas. But when you then realize that, okay, well, there's this large quality and research arm that we do, and why do we do that? Well, we do that because we want to know, again, what value do we provide for new technologies, TAVR, for example. Why is it that we should have a coverage with evidence determination or policy? Why are these things? And so I think that, again, when you can kind of look at it as a series of kind of circles, advocacy really becomes a centerpiece of things. So
Dr. Cleveland.
to your point, the PAC, yes, go ahead, Karen, and
No, I was just
chime in about the PAC, because I think that gives us our unified voice, if that's what I look upon the PAC as.
Oh, no, sorry, I was just going to say, it looks like there's a question from the Q&A.
Yeah, there is, and I was just going to come to some of those too as well. So I see actually from Mahesh Sharma, says, good evening. The STS work group in congenital heart disease has been tasked to begin involvement in advocacy with the STS-PAC. Who can help our workforce members get started? Thanks for sharing the flying option. So I think that's a perfect segue for you, Dr. Kim, to answer how do we kind of link the congenital group with the STS-PAC?
Yeah, excellent. I mean, individually, of course, they can contribute if they're eligible donors, but then if the members themselves are interested in being part of the joining the STS-PAC or or being part of our overall advocacy efforts, I think that we can have our congressional staffers. We can I can check with Courtney and see how we can get them involved.
And I think, again, to Vinay's standpoint too, and his question, what he was getting at is, again, when you look at the reaches of advocacy, it can definitely touch these different workforces. And so, for example, there are issues in congenital heart disease that are very specific. But again, when you want to amplify what that message is, working with the PAC, the fly-in are very attractive ways to be able to collectively hear your voice.
And depending on the issues, there may be specific members of Congress who
Yes.
Are sponsoring or co-sponsoring relevant bills in that particular area of interest that that our staff can kind of cue us into. And so if we know what those important issues are from the workforce, then we can work to try to see how our priorities for disbursements can be impacted.
And along those lines, exactly, that's the same way that we develop kind of our advocacy kind of priorities. Is this is what we want to hear is from the grassroots members and the other workforces. What are the things that are kind of things that are kind of not necessarily burning fires, but what are the things that are really kind of focused that your work group is focused on? We've got a question from Jose Chacon. Says, how can a medical student without a home program to be involved in the advocacy group? And I guess I would ask, I would posit that obviously, so the STS has a lot of different ways one can get involved. In fact, we have candidate members. We have things where you can get involved where you don't have to have, I guess, by a home program. I guess you're meaning like you feel like you belong to a cardiothoracic surgery group. If you're an interested person in the issues of thoracic surgery, cardiothoracic surgery, we welcome you as a candidate member, and there are ways to go about applying. You can look through the web-based format for how to do that. So that's an excellent way to do that. We and the way to get involved are also to self-nominate. So for anybody on the call, from medical student to senior surgeon and all aspects in between, self-nominate. Don't be shy. If you have you say, listen, I want to explore more of this, put your name up. And if you don't get it the first year you nominate yourself again. At some point, you will likely be asked to get involved with things, and there's a lot of different ways to do this. So that would be my my answer. Vinay, you've obviously let me see what your thoughts are on that involvement too for medical students. You obviously are at a large academic medical center where you have students. How would you suggest this person engage the STS?
Well, I think first, in any mentorship capacity, whether that be through advocacy, academic achievement, or whatever the pathway, all medical students are welcomed, all early residents are welcomed, all general surgical residents are welcomed, and seek mentorship in whatever pathway that leads. If it's advocacy, if it's through your own career aspirations, one of the great things about this organization is that mentorship is highly valued. And this is the ultimate mentorship in terms of advocating for the entire specialty, but start with your local mentor and CT surgeon, because I'm sure they will support you. If not, there is a mentorship portal that even medical students can access through the STS website, and the mentorship portal through STS can then pair interested parties, whether that be advocacy or a certain subspecialty interest, and actually get you directly in contact with an STS leader. But I would just want to make one comment on something you said, that the STS advocacy pathway is not only for STS members, it's for the entire specialty, regardless of what flag one flies. This is for the CT surgeons and our specialty, not only going to the Hill and talking with our congressman to move certain elements forward, but the value of what we do every day. The RUC, the reimbursement aspects, it is so critically important. And I wonder, for those that are not familiar with the RUC or how we value what we do, could you just maybe explain that to some of our members? Because there's a lot more once you start to peel back the onion that this august group does for our specialty.
That's
Sure.
a great idea. And that's like Frank, exactly. That's right up Frank's bailiwick.
Yeah.
So.
So sure, the RUC is the Relative Value Update Committee, essentially. And the surveys you got, you just saw a number of people just got surveys about ultrasound, okay, in cardiac surgery, echo, or in cardiac surgery. Those surveys, okay, give us the data, you know, of what you're doing in your practice. I mean, the work that's involved in things that we take to the RUC. Basically, Joe, okay, as a member of the RUC panel, but we take it to the RUC and basically sort of defend the valuation, make suggestions for the valuation. At the end of the day, what people don't realize though is the RUC only suggests valuation, RVUs, work RVUs, which are used in some of your compensation models. Ultimately, CMS decides, okay, on the work RVUs. And then they have to publish that once a year in the proposed rule, which we're going through now, and then we'll be commenting on things. The CMS does not always agree with the RUC valuation. It's rare, if ever, that they think the RUC has valued things too low. Okay, and they always think it's too high, but we will then defend, okay, the valuation that we came up with and suggested to the RUC and that the RUC had. On the other side of the spectrum, I did see Ed Okies. Okay, so I was like, is there a role for senior members in this or retired members? Okay, so we talked about students and things like that, but I mean, clearly there's a role also, you know, for our senior members, and I think our legislators want to hear from them also, but maybe somebody wants to comment on that.
Yeah.
I think that's a great comment, Frank. Go ahead, Karen, Dr. Kim.
Well, first I would say you're a constituent, and congresspersons care what their constituents think. Second, over your career, you've been a provider of healthcare, and you have seen, you know, changes in the field of cardiothoracic surgery, new technology and how that's impacted patients, new procedures, changes in, you know, medical management of cardiovascular disease. And cardiovascular disease remains the #1 killer of patients in the United States. So you're an expert in it. Even if you retired, you know, you are still, you're part of the specialty, and you continue to like understand these issues that are pertinent specifically to cardiothoracic surgeons. And then lastly, you may or may not be a utilizer of healthcare, and so you have that perspective as well. So I think that our retired cardiothoracic surgeons would have a lot of expertise and value to offer in our advocacy efforts.
I think there could also be the historical perspective of the database, okay, going, you know, for some people from where there was no database to where the database is now, which really no other specialty has anything quite like it, particularly when you talk about the cardiac surgery numbers. I mean, millions and millions of patients. So I think you would have grown up, okay, through the database also.
I had one or two other questions that we have. Let's look through the portal here. Just looking.
While you're looking, maybe I'll just kind of give a summary comment that I thought that Frank, you did a great job explaining what the RUC is, but sort of to also translate it. We have many surgeons that are perhaps watching or will watch this webinar that are of mixed background and knowledge of how the practice of medicine works. They show up, they get a salary, you know, how's that salary calculated? How do they value? What is MGMA? What is work RVUs and how it works? You know, almost every practicing surgeon realizes that someone pays and someone values what they're worth. It starts here. It starts with this effort. And I think that's how this is translated. And I just wanted to make that punctuated point that by getting involved and responding to surveys and supporting the efforts of all of you, you're the sort of knights that go out there and battle to make sure that what we do is valued. We may not win every battle, but you're still in there defending the specialty as well as STS members. But really, this is about the specialty and making sure that that a CABG or a lobectomy or you know, a congenital heart operation does not have the same value as, you know, doing a knee operation or podiatry, which people would be shocked as to what things are valued in our practice of medicine. And so for the practicing surgeon that's out there, This is not some amorphous thing in some little area. The rubber hits the road with this work. And I think that's what's valuable for all of the members watching today.
And even as more and more cardiothoracic surgeons are employed by hospitals, well, somebody is submitting, okay, a bill on your part, okay? And there's two parts to reimbursement. There's the DRG hospital payment, which the hospital or the health system is interested in. And then there's also the professional component. So even though you may not be doing that day to day for yourself, okay, the hospital's doing it. So therefore, you know, getting your work valued, okay, does in one way or another indirectly come back to, okay, your reimbursement package.
And if there's a lot to kind of take in on a webinar, please do look out for a paper that kind of summarizes all that we've been working on. That'll hopefully be featured in the annals soon.
Yeah, thank you, Dr. Strobel. You're exactly right. That's again, just like the written pieces, the compendium pieces, we try to issue some things to kind of demystify some of this process, because I'm sure as you know, it's when you first getting started, it's just daunting enough to sometimes think about, you know, how am I going to, you know, do a bunch of operations, do this sort of stuff. But then you start to realize that, yes, there's a process. It's important. I have one last question for Dr. Kim, because I don't think she's done a very elegant job in her presentation. I think she did a great job of really summarizing the fact that, you know, we're not red, blue. We're just basically what we care about is issues that affect the society and our patients. But what really happens, Dr. Kim, when I write my check to the PAC? I mean, what kind of things does that enable us to do with these monies?
So the PAC is a tool to disperse those funds to be able to elect or support members in Congress who can pass the bills that we need to be able to get things done that will help our patients and our specialties. So your dollars that are hard dollars that are slated to contribute to those, they don't pay for dinner parties, they don't pay for like office space. These are hard dollars that go directly as per the STS-PAC's priorities to those congresspersons. There's certain limits to the amounts that can be given. Again, we have a ranking of priorities that help us figure out where the dollars will give us the most impact. And again, it's very important for us to hear about the particular issues of our members. Members in different parts of the country may have different issues that affect them, and depending on the race of that state, the congressional race that's taking place, the candidates who are up for election or re-election, you know, certain states, certain congressional candidates may be really important to support in a given year. And that's how the STS-PAC can make a difference in supporting those candidates. So I would say what in that graph that you saw, where the monies went, that's where the dollars went. Thank you.
Courtney has called my attention. I can't see the chat box, but we do have a couple more questions that come in. So Courtney, please, how about the next question?
Oh, I'm sorry. I think that was all from the chat.
Oh, no. Okay. That's great. Well, I very much want to thank everybody for your time tonight. Are there other questions the panelists have before I wrap this up, by the way?
No, I'd just like to echo the thanks to you, Joe, for your leadership, okay, in this, and certainly Courtney and the Washington, D.C. staff. There's a lot that goes on, okay, behind the scenes that none of us know about, and it's important.
Well, thank you, Frank. And I think that's a very fitting way to sign off, and to thank Courtney and her team. Again, they enable this entire process, and they truly are professionals. They are our eyes and our ears for us in DC. It is rewarding and absolutely professionally, I think, as I said, part of our responsibility to advocate for ourselves and our patients. But without Courtney and her staff, basically, we could not accomplish what we do. So thank you very much. With that, I'll wish everybody a good evening, and remind everybody this webinar has been recorded and can be viewed. And again, my final plug will be to please sign up and come to Washington. Again, if you haven't done it, it's really invigorating the first time. If you've done it multiple times, there are new things to be learned. And as always, our representatives that we have heard tonight want to hear from us, their constituents, what the issues are. So that is September 13th and 14th. We look forward to seeing you in Washington, where we can all join together as a unified voice for our patients and for our specialty to promote the STS and what we want to do for our patients and our specialty. Thank you again. Good night, all.
Join us for the next two STS webinars. Rapid Fire Patient Safety Rounds 2.0 will be held on Thursday, August 4th at 7 p.m. Eastern. And Rest After Cardiac Surgery, Is Your Team Ready? Will be held on Thursday, August 18th